Hi folks, well it's Dr. Hutter again, and today I'd like to share with you an analogy that I learned from a retired chiropractor friend of mine a little while back. It's a way to help you understand what happens in your body when you get adjusted. Before I begin, however, I just want to remind you that if you find these videos informative or entertaining, please forward them to any friends or family members that you think could benefit from our care, because I'd like them to benefit from our message also. I have an assistant in the studio with me today to help demonstrate this analogy. Would you welcome my son, Graham? Graham generally works behind the camera for me. Graham, today we're going to demonstrate for the audience what happens when we have pressure on a nerve and how the chiropractic adjustment helps relieve it. To do this, I have a elastic, and this regular elastic band we're going to put around your finger. And this represents pressure. Pressure on a joint capsule or pressure on a nerve. Pressure that is in a place in your body where it doesn't belong. Usually it's going to be along a spinal nerve perhaps. Immediately, probably doesn't feel so bad, does it?
Not really.
No, it's not bad. However, as we look at it, you can see that there's actually a change in color happening at the finger already. You're already beginning to turn kind of pink there. We're not getting the normal flow of blood down to the tip of the finger and back again through the venous system. And the same thing happens in the body at other places. When we have pressure on a nerve, we immediately get a vascular change that happens there. We get some inflammation which occurs. Still feeling pretty good?
Alright, it's starting to become a little irritating.
A little uncomfortable, yeah. When people are feeling some irritation or they're uncomfortable, there's many different approaches they can take. And one of those approaches is they reach into their medicine cabinet and they might try some aspirin. Do you think maybe we take some aspirin, put it in your mouth, drop it into your stomach, get the pressure off that nerve?
No, I don't think that would do
No, not going to do it. Well, if aspirin doesn't work, we can use one of the ibuprofens or Tylenol perhaps. Go bigger.
I don't think so.
No. We can do the prescription route. You know, using some sort of a pharmaceutical to help reduce inflammation, reduce pain. You know, we could shut off the pain signal using a pharmacologic agent. Not what you're looking for. For those people who don't want to use drugs, there's always the topical analgesics. You could rub maybe some Tiger Balm on there or some Biofreeze. That'll help relieve you from the discomfort. We could smear that on there. You think that'll distract you a little bit?
No, I don't think that's going to help at all.
No, huh?
No.
Well, there's always massage. We could massage it. We can send you to one of our massage therapists, and for all the good they do, they can be quite beneficial for some of our muscle problems, but in this case, probably not what you're looking for either.
No.
All right,
I
well,
don't think so.
Other options, of course, we can go the medical route. Our medical colleagues are very good at controlling pain and affecting inflammation. We could do the injectable route, right? We could inject it with something and reduce the inflammation. And
not a huge fan of needles.
not a huge fan. Okay, well, there's always the surgical route. We could get in there and relieve the pressure by cutting. Not what you're going
I don't
for.
like really anything being cut.
Physical therapy. We could kind of strengthen up the arm and the hand and get it to function.
Don't think that's going to do much in the pressure department.
No. All right. Well, you can see we're really getting a lot of discoloration, and the longer it stays, the worse it's looking. In the chiropractic realm, what we're looking to do is reduce the pressure. Take the pressure off the nerve. Get the body to function normally. Get those cells to reach a homeostatic stasis by improving the function. So whether it's working on the injured or irritated joint, realigning the joint so that it moves more normally, either way what we're going to do is try and reduce the pressure, and you can see immediately we get a relief of the discomfort, we get a change in the fluid dynamics of the area. Hopefully a healing process has begun. Well folks, that's our way of illustrating for you today on this video what happens when we render a chiropractic adjustment. What are some of the changes that take place in the body, and of course how it relates to some of the other therapeutic options. Now, before I say goodbye, I just want to remind you that we're in the middle of summer and our summer promo is underway. So each time you come in through the summer, you get a chance to win an iPad. If you haven't been in a while and you come back for care with a problem, you get 5 chances to win, and if you make a referral to somebody who's coming into the office, you get 10 chances to win just for making that referral. So I hope to see you in the office. I hope to help your referrals get well. Naturally, we're looking forward to a healthy and happy summer, and I'll see you soon. Thanks a lot.